and welcome to the Dementia Doctor. Today we have Mr. Lee here sharing his wonderful research. So first of all, we would like to know who you are and where do you live, and then we'll hear about your research as well.
Okay, thank you for inviting me to this great opportunity. My name is Hahyun Lee. I'm from Korea and I recently graduated in master's degree in Seoul National University. So I am working now as a clinical researcher in Boramae Medical Hospital.
Wonderful. So we learned about your exciting research. Can you tell us more about what you're doing in Alzheimer's disease?
Yeah, so our question is how we can apply the large language model, the AI, to the dementia assessment and treatment. My work is to evaluate the clinical dementia rating scale, which is used in clinical trials and research and in hospital setting, whether the AI can detect or assess the CDR correctly compared to the expert level.
Oh, okay, that's really exciting work. So we have the influx of AI in every field of medicine, as we know, and this would be really helpful. So clinical dementia rating scale is an interview done with the person who has memory problems and then informant. And with this interview, we kind of grade where they are, if their thinking and memory is normal, or if it is questionable cognitive impairment, mild cognitive impairment, moderate or severe cognitive impairment. So you're saying you're bringing AI into helping us with this scale. Can you tell us more how the AI is helping us with this interview?
In Korea and of course in the global, many people are troubled in their own severity of the dementia, and the caregivers have bad situation due to their family's hardship. And the many experts like clinicians or psychiatrists or gerontologists, psychologists, there are a limit of these experts. So LLM and AI could help them, not only for the patients and their family, and then to the clinicians to expand and validate these evaluate tools in the world.
So that's really wonderful work, and you kind of bring on two important issues about using these scales. One is language. So a lot of us are not using English as our first language. So that's one issue. And the other issue that you brought was we don't have as many clinicians or individuals trained to do this scale, so not everyone can get this screening. So tell me, are you doing something about both these issues, the language? Are you developing a Korean version, or what exactly are you doing with that to help us with that?
So in a real world, in-person assessment should be done to accurately assess the CDR scale. But in our study, we use the text-based transcript version, which clinicians record the assessments between conversations or records between patients or with the caregivers. Mm-hmm. So in that text, we have information about the patients and their caregivers and knowledge about the CDR 6 domains like cognitive and functional domains. Mm-hmm. So using that information, the LLM could assess each domain and assess the CDR.
So actually, you're just using those conversations to infer more information about the cognitive status of the person. You're not doing anything extra. You're just giving the CDR scale, but you're recording the conversation and using AI to say if this person might have cognitive issues. Is that correct?
Actually, the purpose is more focused on the assessment, looking at that information.
Okay.
Yeah.
Okay.
The AI should figure out on which domain is in that context of the text, and what severity can AI could assess during reading that information.
So what I was wanting to ask is that, you brought up an important issue that we don't have a lot of clinicians and people who are trained in CDR to give this tool to our families and seniors who have memory problems. Is your work to also make it more accessible by training AI to do this, or we still need humans?
We still need human right now because we need to put the rules of the CDR to the AI. So we need help of experience to do protocol to organize what information should we give to the AI.
Yes, that makes sense. We are kind of combining the best of both worlds, the humans as well as AI. Is there anything else about your research that you would like to share that I haven't asked yet?
Yeah. The main problem I said earlier is the validation and culture and language without discriminating these things, but it could be also helpful for the junior clinicians or who does not be the real expert. So they could use this tool to evaluate accurately and how to evaluate CDR by referring these tools, I think.
Oh, okay. So what I understand is that because most of the tools like CDR or any other testing is developed primarily for individuals who speak English as the first language, we are now looking at it with the help of AI to also expand it to make it available for individuals who don't have English as the first language, for example, Korean in your case. And that way, this screening tool it is used in a lot of clinical trials to kind of see how individuals are progressing while they're getting medications. And this will also enable having more access to clinical trials as well for people who speak different languages to be included in the clinical trials.
Of course, yes, that's right.
Yes.
And the final word is we are enlarging and developing these tools and this protocol to not just for the CDR assessment, but to the dementia diagnosis or other neuropsychiatric disease, something like more depression or anxiety.
Oh, okay.
Could be helpful to everyone.
So are you looking at other tools like the MOCA or MMSE that we usually do in the clinics?
Yeah, of course.
Okay. So you're working on also using AI to help us to also listen to the language while we do the clinical assessment in the clinics and help the doctors to get at the more accurate diagnosis. And as I understand, you said even depression, so you're looking at the depression screens and anxiety screens and incorporating that as well?
Yeah, that's right.
Yes. So thank you so much for coming to our channel and sharing your research with us.